In my daily practice as a pharmacist, I have noticed an increased number of hypertension cases. Surprisingly, many of these cases are young people. Hence, I have collaborated with a public and preventive healthcare advocate, Dr. Elipilius Chiwaya, who has been a strong advocate against hypertension and salt intake in our population. Let's learn together.
So, what is hypertension? Hypertension is increase in the blood pressure. This increase in blood pressure is referred to as BP. So what is it? It is basically the increase in the way the blood moves. The blood moves at a certain range of pressure in your blood vessels. But increased blood pressure in a patient who has developed hypertension, it causes the blood vessels to stretch, to expand, and as they try to expand, they try to develop more mass and also begin narrowing and stiffening. Why? Because it needs to handle that pressure. But for organs, very sensitive organs in the body that cannot handle that pressure, they begin getting damaged. So that is basically hypertension. What are the causes of hypertension? I commonly refer to these causes as high 7. There are about 7 predisposing factors to hypertension. Number 1, increased salt intake, which is very common in the black population. Number 2, old age. Increased age is a predisposing factor. Genetic factor, alcohol intake, smoking, obesity, and lack of inactivity or sedentary lifestyle. These are the causes or risk factors associated to hypertension. Hypertension currently is on the skyrocketing trajectory in our country, and it's raising a public health concern. Why? Because statistically, as it stands now, Zambia is sitting at a prevalence of over 34.8% of adult population living with hypertension. Of this, what we are saying is, out of 10 people, 3 or 4 people are living with hypertension. And what makes this worse is over 46% of the people living with hypertension in Zambia are unaware that they have hypertension. And over 687 deaths every year are recorded relating to hypertension and cardiovascular diseases, which is a very serious issue that needs immediate and concerted action. So, why should we be so concerned about hypertension? Number 1, hypertension is the leading preventable cause of premature death in Zambia. 1, it is preventable. 2, it is manageable. So understanding that there's something we can do about it, it gives us a call to action to say we can do something about it at national level, community level, household level, individual level. How can we prevent, how can we collectively respond to this rising public health crisis? Let us make sure we address, number 1, the sodium content in our country. Salt intake in our country is on the high. WHO recommends a minimum of less than 5 grams of sodium or salt in a day per individual. This translates to about 1 teaspoon of salt in a day. But when it comes to Zambia right now, the intake of salt is very high in that it's about 9.5 grams of salt per individual in a day, according to available research. This leads us to also a concern, which is what is called salt-sensitive hypertension, which is the hypertension that is more actually common in the black population, which means we need to make sure we address the salt content in our population at individual level. Are you concerned how much salt you're taking in a day? Are you concerned before you grab that drink how much sodium is contained in that drink? How much salt you're taking in all these fast foods you're taking? If we do not address this concern, we are sitting on a ticking time bomb. Let's rise to this occasion and prevent this silent killer. Why is it referred to as the term as the silent killer? One, because it rarely shows symptoms. If any person is now starting to present symptoms, it is because there is now end organ damage that is beginning to happen. So it is referred to as a silent killer. It will never give warning. Most of the people, by the time they are presenting, they'll present with heart failure, heart attack, stroke, kidney failure. These are some of the problems that are resulting, end organ damage that is resulting from uncontrolled hypertension. How is this? Understanding how this is causing this problem is important, because you understand the most important reason we need to check your blood pressure. You need to know your blood pressure. You need to make sure you are on treatment if you are hypertensive. If you are not hypertensive, making sure you take the necessary measures we've been discussing here to ensure you control it. Number one, the blood vessels in the brain, because the pressure is too much, they rupture, causing the stroke. There is a very devastating effect, complications that comes with stroke. Some of them are irreversible. On the heart, the blood vessels begin narrowing or begin stiffening and will begin getting blocked. Somebody from nowhere will have a heart attack. Somebody just falls, drop dead. Why? Because of the hypertension. That person never knew that he had hypertension. That person wasn't on treatment, or if he was on treatment, he was just taking medications when they feel like taking, which is very dangerous. As the blood is moving, the heart is trying now to pump against this pressure. The heart tries to remodel, try to remake itself, try to build more mass, trying to handle this pressure. As it is building more mass, it is destroying itself. By the time somebody is realizing, the heart is now failing because it has weakened because of the pressure. The very important reason we need to be on treatment if you have hypertension. If you don't know your blood pressure, check your blood pressure today. Things to do with kidney failures, they start in the same mechanism. Therefore, hypertension is a problem that you need to look out for. Is a problem that you don't have to look at the old person that is the one who is predisposed. As we are talking about salt intake, which is the biggest problem right now. The sources of salt is so wide, causing a huge increased risk to all populations, not only adults, even in young people. Know your blood pressure today. In summary, know your blood pressure today. Make sure you control your blood pressure. If you are hypertensive, start your treatment. Be consistent with your treatment. And make sure you seek medical help. Go to those facilities whenever you see any symptoms that is uncomfortable with you. With this, we can prevent so many deaths in Zambia. We can prevent deaths of our loved ones. We can prevent deaths of the people even coming after us by developing some of these health habits. Remember, fear salt, cut down on salt, say no to salt. Thank you very much for your attention. It is me, Dr. Explains Hypertension. God bless you.